Hey everybody, welcome to using point-of-care ultrasound to diagnose shoulder dislocations. This is a fairly simple, quick, easy to learn, easy to perform at the bedside, and if you look at the recent literature, quite sensitive and specific. So I like doing these ultrasounds from the posterior aspect of the patient. So if you take a look at my diagram here, we have anterior and posterior, with our patient's nose facing the front. The thing I want you to look at is we're kind of coming down from a bird's eye view. Most laterally, we have the humerus, which articulates with the glenoid joint here, which is part of the scapula. And we're basically ultrasounding from behind the patient. And so we're going to see the outline of the humerus laterally and actually the spine of the scapula medially. So now if I get rid of our skin and our skeletal frame, you can imagine what our ultrasound machine is going to see posteriorly is going to be laterally a nice smooth ball shape from that humerus, and then you're going to see a very sharp line from that scapula. So this is what that ultrasound is actually going to look like. Here's a real life example. You can see smooth ball of the humerus head and then the spine of the scapula right next to it in the same line. Now let's say that same scenario, but we have a anterior dislocation, right? Now my humerus has moved more anterior to my body, which, since I'm scanning from behind, means I'm actually moving away from the ultrasound probe. So in this scenario, when I scan, I'm still going to see that nice smooth head of the humerus, but it's going to be further away from the screen compared to my scapula. So now we're going to see this. And here's going to be a real life example. So finally, there are going to be your posterior dislocations. Here the humerus is moving more posterior compared to that spine of the scapula. And your ultrasound image is going to look like this. You're still going to see that round head of the humerus and then the spine of the scapula sitting away from it, or deeper in the probe. That is a real life example. Notice you can see a lot more of the head of the humerus and then posteriorly the spine of the scapula. Hopefully this quick primer gets you more comfortable both scanning and interpreting shoulders for ultrasounds. Again, if you have any questions, leave them in the comments, and thanks for watching.